if you don't smoke, you're not.
And the vapes are also
I mean, it's not rocket science, is it?
Yeah.
There's a junior doctor waiting in the window. I know he's going to support me in this. It's nice to see you. Thank you. Let's tell you quickly what's happening as far as the papers are concerned. The Metro asks, is there a doctor in the house? Yes, there is, as junior doctors commence 4 days of industrial strike action. According to the Eye, some 350,000 appointments and operations are likely to be cancelled, far more than was originally forecast. The Express advises readers not to get ill. The Mirror leads with details of junior doctors' pay, which it says works out at around £14 an hour. And the Times is expecting disruption to the NHS for up to a month. Let's talk about it in more detail with Dr. Parth Patel. He is a junior doctor. He's also a senior fellow at the IPPR think tank. Hi, it's good to see you. Thanks for joining us. Smoking's bad. Let's just...
we can agree on that one.
Yeah, we can agree on that. We can't agree necessarily on what we've been hearing this morning from the BMA telling me that they can't guarantee that lives will not be at risk as a result of this 4-day action. I thought being a doctor was a vocation to save lives.
Well, that is true. It's implicit within the job. Doctors act in their patient's best interest, and to some extent, actually, doctors are saying things are so bad on a day-to-day basis at the moment that they can't practice the kind of medicine that we've been trained to provide. And so the reason for the strike action, in part, is motivated by patients' best interest. It's worth saying there are two actors here, doctors who have an inherent duty to act on their patient's best interest, but the government, an elected government in a democracy, whose main function is to act in the public's best interest. So we should be applying the same question to the government. The way it's approached this industrial dispute with doctors, is it acting in the public's best interest? Could it have pressed pause on the strike this week? In a way it managed to do with the nursing union. It opened negotiations and pause was pressed. That hasn't happened this week. There's a more acrimonious relationship with the doctors' union, and we're about to experience a really tough week for people who depend on the health service and for people who may need the health service in the next few days.
Doctors' first job is to safeguard the lives of patients, and the union, let's call it a union, BMA, that represents doctors, sat there this morning and said that will not happen necessarily this week. How can that be?
Well, let's think about what's in people's best interest. This week it's going to be tough, so there's two things, broadly speaking. If you're a person in this country who may need the health service, you don't want the strikes to happen this week. You also want to make sure there are enough doctors working in the health service to bring down waiting lists. So you have to stop further strikes. You have to stop the exodus of junior doctors going to Australia and going to New Zealand. There really is an exodus. There's no way we're going to bring down waiting lists in the NHS unless we have enough doctors. And the reality today is that we don't. So that is partly what's going on here. So in patients' best interest is to press pause this week and to pay the doctors more. We need to get to that resolution sooner rather than later.
Yeah, but if somebody falls sick today, or a relative of someone watching the programme falls sick today and they die as a result of the doctor strike, they're not going to be taking that into account.
No, they're not. I can't believe it has come to this, Kay. It really is a disastrous situation, and there's no way of getting around that. I do wish that the union and the government could have come to an agreement to have called off the strikes this week. That hasn't happened. We have to interrogate why. The government at the moment is asking the union, you call off the strikes and then maybe we can talk. Now, I'm not a union negotiator or an expert in industrial relations, but that's not really how this works. You have to come down and open some kind of negotiation in the way it did with the Royal College of Nursing, and the union will say, OK, let's press pause, let's see where we can get to. We need to get to that step quickly, and we're not even close to it at the moment.
How worried should doctors be about losing the support of the public?
That's anybody's guess. At the moment, the public is quite on board, actually. I think about 54% of people up and down the country support doctors. Around a quarter are against the strike. So that's a similar amount of support that we saw with the nurses. That's quite a strong bulwark of support. I think the public realise that there's been a massive transformation of what it means to be a doctor in this country. It's become a lot less rewarding and a lot more challenging. You go around fighting fire on the wards, looking after 30 to 40 patients, just trying to avoid a patient safety incident. The whole concept of patient dignity has been out the window for several years now, and I think people and patients recognise that. They want that to change.
What needs to happen for the strike to be called off this week?
The government needs to probably come up with a credible, reasonable opening gambit.
What does that look like, do you think?
I don't know. It's obviously not going to be 35%. It's obviously higher than where they are at the moment. They need to work out how desperately do they want to bring down an NHS waiting list. It's one of the Prime Minister's 5 priorities. And to make a reasonable offer that says, we're serious, we want to talk, let's resolve this. I don't know what that figure looks like, but it's higher than where they are.
Percentage chance of it being called off this week?
I don't want to put a number on that.
It's not going to happen, is it?
It's hard to see that happening, yes.
It's good to see you as always, Doctor. Thanks for taking your time. Thank you. Bear with me 1 second. Weather's